Treatment for OCD is different for everybody. It's different from you, then it's going to be different from me. And we know that because everybody responds differently to treatment and everybody engages in treatment differently, which is equally as important. So what we do know is that the most effective treatment for OCD is often a combination of medication and exposure and response prevention. What I know is that I have lived OCD treatment. I know what it's like to not want to engage in treatment, and I know what it's like to fully engage in treatment and be actively immersed in the appropriate treatment that's effective for OCD. What I can tell you from a personal perspective is that when you are actively engaged in treatment, which means you're doing the homework, you're doing your exposures, you're working with your therapist, the results are grand. You will see results that are like none other, and you will be able to understand that, hey, it is possible to get control of my OCD. What I can also tell you from a personal perspective, unfortunately as well, is that if you go to treatment and you don't engage in your homework, you don't engage in your exposures, you won't see benefits. What will happen is you might feel a little bit better because you're going to therapy, you're getting to talk to someone, but if you're not doing the work, you won't see the results. It's just like exercising, dieting, and going to the gym. If I go meet with my nutritionist once a week, but I'm not following my diet regimen and I'm not exercising, probably not going to see great results. But instead, if I'm doing my dieting and I'm going to the gym and I'm actively exercising, I'll see results that are much better and much quicker. A word on quickness as well is that I think often we think if we go to therapy, we should see results overnight. One thing to keep in mind is that OCD is a chronic mental illness that we live with. Sometimes it takes a long time, which can be 12 plus sessions before you really can manage your symptoms or before you really even notice a difference. So don't expect that after one session you're going to see a difference. Expect after 3 or 4 you might see or see a little bit of a difference or understand what treatment will look like, and expect after 12 weeks or 12 sessions to see a pretty significant difference. That's if you have less severe OCD. If you're in an inpatient or residential treatment center, certainly that would be different. But my word of advice on treatment is that it's like anything in life. It's what you put in is what you're going to get out. And so we have to work hard. The amazing part for those of us with OCD is that there's effective treatment available, and it's pretty difficult to engage in. I know that. There's times that I don't want to do my treatment. There's times I don't want to do my homework, and there's times it seems impossible. But what I know is that if I push myself and I do the things I'm supposed to be doing, that's how I can see the benefits, and that's how I learn and you can learn to manage your OCD.